right, they're not kidding. Kids get the coronavirus too. The latest numbers bear it out. Nearly 100,000 children testing positive for COVID-19 in the last 2 weeks of July. That's up 40%. California, Florida, Arizona seem to have been among the highest concentration of these new cases. Should we worry about this as we approach a school year where a lot of folks are worried about kids possibly exposing others, let alone themselves, to the virus? Dr. Nicole Saphier, and also the best-selling author on all of this. Should we worry, doctor? What do you think?
Well, of course, Neil, we're still in the middle of a pandemic. Children we know can be affected by COVID-19. They can even be severely ill. And we've had 86 children who have died from COVID-19 since May. That being said, Neil, we still know that children are less severely affected than adults are. But this new report from the American Academy of Pediatrics is quite startling. They're showing a 40% rise of cases. I will tell you, in children. I will tell you, Neil, though, this report leaves me with a lot of questions. One being, what are the age groups? Several states, they were saying children are ages 0 to 14. Alabama said children included those young adults up to age 24. So that brings some questions for me. But also, Neil, why are children being tested? My children, they have to have a negative COVID test before they can start. So I would imagine that we're seeing a lot more testing in children right now as they're trying to get back to school, trying to get to summer camps. So we're probably capturing a lot more of those asymptomatic carriers than previously seen. They haven't broken down those numbers. Up until now, it's been about 5% of new cases has been in children. This new report is about 8.8%. I do think there's probably some increased transmission around children, but I would be surprised if it is as high as that 40% as that report is saying.
I'm also wondering, doctor, how reliable it is. The case of the Ohio governor, given one of those quick antigen tests, I guess, initially tested positive, then at least 2 other follow-up tests, he tested negative. How does that happen, by the way? And should that be a reminder to us that maybe these numbers aren't what they appear either?
Absolutely, Neil. I mean, we have been dealing with since day one. There is a high rate of false positives as well as false negatives when it comes to the antigen testing as well as the antibody testing that you take from the blood. And that is due to cross-reactivity, maybe other viruses that may be in the system. It may be from prior infections being there. It may be there's not enough virus there to be tested. There's a variety of reasons why these tests fail, but it is not so uncommon. And even the flu test has a very high false negative and false positive rate. So it's not just specific to this novel coronavirus. We see it all the time, but now because everybody's watching for these daily counts every single day, we're putting so much more weight into it than we ever have before.
Yeah. As a young mom, and we get into this a lot, are you leery sending your kids back to school in person if that were even an option in your community?
Well, Neil, I can tell you, a mother of 3 boys, I am such a supporter of trying to get my children back to school. But that being said, I want to do it smartly. I'm terrified that my children will get COVID, not necessarily because COVID is any worse than, say, a strep throat or a flu or any of the other things going out there. But because there is such community spread right now, I don't want my children to be a part of that. I need my community to do what they can to lessen the spread of virus so our children can go back. I'll tell you, Neil, the mental health effects of our children from being home and not being around their friends and with their teachers was devastating. My littlest one, 5 years old, he had a lot of anxiety, a lot of depression, as so did many of his friends. And I think that we are breeding a generation of children being underdeveloped if we don't do everything possible to get them back there. Yes, I want to protect the teachers. I want to protect the family members that are vulnerable, but our children have to get back to school. I also get concerned, though, Neil, about them going back to school, sitting in these plastic partitions, wearing masks, because that may not be good for them either. So we have to do everything we can as a community to lessen the transmission of virus and get our children back to school, but in a normal environment. Because if they can get back to school, but again, they're covered in masks and partitions, is that really what's best for them? And I'm not sure I can answer that. I'm very leery to get our kids back to school, but I very much want to get them back to school.
Well put. Doctor, thank you. Best of luck on that, too. I mean, with kids, it makes it very, very scary for everyone involved.